Choosing a career path, especially nursing, can be an overwhelming process. Here are the answers to the most common questions prospective nursing students have. Simmons is a teaching school. However, over the summer you have the opportunity to apply for the SURPASS program, which where you apply for a grant and work with a faculty member and spend the summer researching at Simmons.
That's common. People don't know if they want to go into nursing all the time. If you're interested in the health sciences though, definitely take the general bio and chem classes that are offered freshman year, because the general science courses will transfer to other majors and courses of study, whereas the nursing classes will not transfer.
Yes, nursing students can double major, however it is not so common because classes and fitting in scheduling is quite difficult. However, most nursing students minor in psych or nutrition. I'm getting a minor in business management. Nursing students can absolutely do study abroad. I did a program over the summer for 2 weeks at the University College of Dublin. My coursework was specifically in healthcare and health economics. Junior year is probably your most flexible time, and you could go anywhere.
There's definitely a lot of resources if you need help. Your professors always have office hours. There's usually a TA. The tutoring center is always an option. I'm a tutor myself. I tutor in MedCalc, and I always keep a few hours each day, so I have students that come. There's always so many people that are here to help you.
There are lots of student athletes that are also nursing students, and I hear that coaches and professors and students in the registrar work very closely to determine a schedule that will work best for the students regarding practices or games and meets.
The nursing tuition is higher than other majors because our foundation of nursing practice is learned in these simulation labs. There are many of them to accommodate all of the nursing students. And also our clinical staff to student ratio is 1:5, even 1:6. And those small groups are essential for fostering learning.
So clinical is a chance for students to practice skills that they've learned both in fundamentals and health assessment lab and simulation lab, and get to apply the nursing knowledge that they've learned through lectures in a hands-on setting, usually within a hospital or a medical center. And it's a great chance for them to learn the skills and the practices that nurses are going to be doing. Sometimes clinicals are done right in the Longwood medical area, right in our backyards. So Brigham or Children's or Beth Israel. Sometimes a little bit further out, students will go to St. Elizabeth's or Mount Auburn or Cambridge Hospital, Boston Medical Center, Mass General Hospital, or Tufts Medical Center.
The NCLEX is a board certified exam. You take that usually after you graduate. All of the exams and nursing classes are NCLEX style, so you're preparing for the NCLEX every nursing class that you take. As well as when we graduate, we have a week-long intensive where we meet with the NCLEX specialist and we go over the NCLEX in detail before we take it. Simmons really prepares us for taking the NCLEX. We have a very high pass rate, and all the nurses that graduate from Simmons are really well known in the nursing community here in Boston.
So in Massachusetts, the numbers have been typically reading about $68,000 as a starting salary, but it does definitely change.
We definitely have graduates that work in the Longwood area. A lot of our students stay in the Boston area, but also that work all across the United States.
Any students with questions can always reach out to the admissions office.